Okay, so thank you, Dr. Pino, for giving us this opportunity to come together. And I think Joe wants to leave our group from this morning and go home and drink. I don't know. We so enjoyed you, though.
Oh, okay. Yeah.
You did. Drink water, that's right. Someone said
Yeah,
drink
full.
lots of water. But before I get started, I did want to note that our group, oh good, Kim, thank you. Our group that was pulled together, we have been used to working together since February of 2013. And so what I'd like to do before I get into our work, and who's my timekeeper? Is somebody?
Yeah, we're keeping time. Go ahead.
Okay.
4 minutes.
Before we
Okay.
get into the work of the group, if I could invite Dr. Charlie Hardy up to just kind of lay the background around our Southeastern North Carolina Regional Health Collaborative, who we are, why we came together, and how that set the stage for our discussion today with Joe.
Great. Well, thanks. In 3 years ago, I came home. Home was Kinston, North Carolina, and I had been fortunate enough to grow up in just a wonderful area that was called Southeastern North Carolina. And then I'd also been fortunate enough to travel around the world and experience new and incredible things. But 36 years ago, better get that one right, when I married my wife at Wesley Memorial Methodist Church, I promised we'd return. And so when I got off the airplane in ILM, there is a sign that says, "Welcome to Southeastern North Carolina." And that really meant something to me. And so I've been given the opportunity to help build a new college at a young, really young university in an incredible community. And growing up in North Carolina and starting my career at UNC Chapel Hill, I knew we probably couldn't compete with certain schools in the system. So we had to do something a little differently. And we said, okay, well, we're going to focus on enhancing the health and quality of life of individuals, families, and communities in Southeastern North Carolina. The way we were going to do that is through interprofessional collaboration, community engagement and impact, and implementation science. And it was the community engagement and impact that called me to action in regards to calling my colleagues in public health departments, because my previous job is I was the dean of a college of public health, and I knew if you served lunch, public health people would come. And so we had a good turnout, and I just said, "Hi, I'm Charlie, and it's wonderful to be back home, and I need your help building this college, and I would like to offer our help in helping your individuals, families, and communities achieve a higher level of health and quality of life." And what I have in mind is building a collaborative. And those of you who know me, my mantra is building it while we fly it. And I just about do everything in life, including my hairstyle right now, like that. And so I said the basic bottom line is your budgets are being slashed. You have more work to do than humanly possible. Can we fathom a day of coming together, just like Joe has talked about all yesterday and today, and really breaking down silos and getting on with moving the needle in areas that we clearly need to move? And strategically, we brought together 5 counties. 3 of them are pretty natural for UNCW, which is New Hanover, Brunswick, and Pender. And then we have commitments in Onslow and our dear friend in Columbus County. And so those are our 5 founding members. And I just asked them the question, does this make sense? Can it help you? And unanimously, they said, yeah, this sounds like a great idea. Now, what do we do next? I said, well, I don't know. But let's talk about it. Let's think about it. And I said, the first thing I'd like to ask you then is, what are your priorities? And as you know, each unit is required every 3 years to do a community health assessment. So it's pretty easy for these folks. 3 things came up. I bet you could guess them. Obesity, gerontology or aging services, and behavioral health. Our public health system is being bombarded by people seeking out those needs, also directives from the state, et cetera, and trying to do that. And so we spent the last year and a half coming together and getting to know each other, and we think we're close. We've gotten some seed funding from some organizations to help us on this journey. We've created a Center for Healthy Communities. And what we really wanted to accomplish today was exactly what John and Joe set up for us, so that we think we're getting closer on what is it that we can come together, and we believe that the power is in our communities. The whole idea of co-production. We are famous in health departments and many of your agencies in providing outstanding services and programs. Typically, the problem with that is when the money goes away from our funders, the programs go away. So sustainability becomes an issue. And so we're trying to take a look at of how do we, across a region, and get this, actually work across county lines, getting our county commissioners, our other sectors involved to move the needle. Because when you look at North Carolina, I think we're 33 in health rankings. You can debate health rankings all you want to. The fact of the matter is we got room to go. And when you look at our counties in our region, we have a world of hurt. We have a world of need that we can do. And I don't think we're going to be able to do it in our silos. So the concept is we're going to try to go across. Now, turn it over to Stephanie, but the bottom line is this is just the start. This was the founding group. So we see multiple sectors, multiple counties. We'd like to mimic actually the Region 8 kind of structure, so we got 4 more counties to add maybe. We also have people in this room that we need to have at the table very soon. We're not quite ready, but today put us a long way further than we were, so really thank you a lot. So talk to them about what we did today. Thanks for the time. Thank you.
Okay, so with our members, and like Charlie said, we have the 5 counties, we have 7 founding members, so our health directors from each of the counties, CHEC, and then the college. And so today, again, as we've grown together, was a perfect time to start focusing our attention to an area where we really want to make a difference. And so we really came to the chronic illness, and according to the CDC, it's a leading cause of death and disability that accounts for 75% of our healthcare dollars. And in our region, we understand the impact of diabetes, cardiovascular disease, and obesity on our communities. So as we were going through our business case, we realized there was a lot of information we don't have yet. So we were able to start articulating a business case around chronic illness. We mapped out a little bit about what we believed our current condition to be right now. And so we just hit on, kind of our disease model approach and understanding, wait a minute, we may have to think differently to engage our communities around these issues. Understanding limited funds, a lack of coordination and communication. And this really came to a better understanding of who else is doing what around this issue. And then just clarity around purposeful and yet willingness to partner. So this was a dialogue that had us exploring an appreciation for how people are funded and the limitations with that funding to target certain activities or areas, and how can we understand that but then still coordinate that effort for maximum impact. So a lot more discussion to happen in those areas. We do have some homework for December 4th, I think 9 to noon, UNCW, be there. We have the film to know who won't be there, right? No. That's right. So some work that we're gonna get done here. First, addressing the knowledge gap. So we need to get some data in place, do some asset mapping, look at a regional assessment. You know, what do we know about our communities, about our needs, about our priorities? Talked about involving the community and establishing strategies for that. And then identifying who else needs to be at the table. And so here comes the coordination of effort that gets us into the different sectors that health and human services touches. And then the charter collaboration cohesion, because we are on a developmental journey with our partners, there's some work that we need to do to further strengthen our relationships so that we are in a better position not only to grow and invite, you know, bring in others around the table, but also that we have an understanding of how we're going to work together to affect change in our communities working across county lines. Okay? All right, very good. See you in December.
Thank you, Stephanie.
Thank you.